With the experience and resources for cases throughout Louisiana, Walters Papillon Thomas Collins, LLC, is proud to support LPB, specializing in personal injury and wrongful death, with information at lawbr.net.
Agencies will be digging into the information that was provided to find out how we can take full advantage as soon as possible for the state of Louisiana. An update on the testing that we have. As of right now, we have 36 presumed positive cases of coronavirus in Louisiana. Those cases are spread across 8 parishes. That is 13 new cases since yesterday, and the new parishes include St. Bernard, St. Charles, and Terrebonne. As we've noted before, there's a community spread of COVID-19 in New Orleans and potentially beyond. We know that there is one cluster of cases at Lambeth House here in New Orleans, which is both a nursing home and assisted living facility. Obviously, this is a very serious situation for our entire state, and it requires serious action. We've said this before and cannot stress enough. Those who are most vulnerable to COVID-19 are our elderly and those with chronic health conditions. And that is why yesterday steps were taken to limit non-essential visitation to hospitals, nursing homes, state prisons, and parish jails. But younger people play a role too. While you may not have symptoms, you could spread the illness to those who will, and I implore you to stay home if you are even slightly sick. And that's the entire population. Don't go to work. You know, it's time to be good neighbors to one another, and this is one of the things about being neighborly. So the proclamation that I issued does the following. In an effort to reduce and limit the spread of COVID-19 in Louisiana and to preserve the health and safety of all members of the public, all gatherings of 250 people or more between Friday, March 13, 2020 and Monday, April the 13th of 2020 shall be postponed or canceled. This applies only to gatherings in a single space at the same time where individuals will be in close proximity to one another. It does not apply to normal operations at locations like airports, medical facilities, shopping centers or malls, office buildings, restaurants, factories, manufacturing facilities, grocery or department stores. For example, please go to the grocery store if you need to. Go to the mall, go to the pharmacy. However, if you are in a high-risk category, meaning you are elderly or have an underlying health condition, think twice about going out, and if you do, please practice social distancing. This provision may be extended beyond Monday, April 13th, 2020 by further order should the circumstances warrant that. To be very clear, and I think this will probably get to some questions before you ask them, this prohibition does apply to churches and houses of worship with congregations that exceed 250 in a single service. However, churches and places of worship can engage in multiple services and bring the number of people in them below 250. It is important, and this is probably the one time a week where we know that the most number of elderly people and people with chronic health conditions are sitting in pews next to others for at least an hour. And so while it's a very heavy decision, it was one that was deliberate to include churches in this particular executive order provision. This is in keeping with guidance, by the way, the entire limitation on the size of crowds at these different events, the 250. It is in keeping with guidance from the CDC on community spread. It is to do everything that we can to limit the spread of COVID-19 so that we do what we've been talking about. The peak of cases won't be as high as it otherwise would be, and that we don't create demand on our healthcare providers all at one time. So we spread out that demand over a longer duration. I know also there's a major concern about our schools. Beginning Monday, March 16th, all K through 12 public schools across the state will be closed for 30 days, with classes scheduled to resume on April the 13th. And like all of our announcements, this situation will be reevaluated as we continue to monitor developments. It's important to note that school cafeterias will remain open for as long as possible to provide food for those students who need it. We will give parents and caregivers the opportunity we wanted to give the maximum opportunity to parents and caregivers to make arrangements. And we realize that sometimes grandchildren are placed in the care of grandparents when school is out and parents are working. To the maximum extent possible, please work around this situation. Again, the elderly population is most vulnerable, and while children, thankfully, are not impacted nearly as severely as other portions of our population, they do have the ability to spread the coronavirus. So I know that some difficult decisions are going to have to be made, but I'm asking everyone to do the very best that they can to keep themselves and their families safe. All public four-year higher education institutions have announced that they're going to transition to online distance learning. The dates vary at each institution, so I would ask that you all in the public consult with them to get those dates. Go online, go to their websites, and so forth. As for our two-year institutions, Delgado, to the maximum extent possible, has already started its online classes. All other institutions within the Louisiana Community and Technical College system are preparing to go online as needed and as soon as possible. More information will be coming from the LCTCS system and from those institutions. Given the critical need of our healthcare system, we're encouraging all healthcare organizations to work with our medical students to keep them in their clinical rotations and on the job. Second, while ensuring that state government remains operational, we're going to lessen the need for face-to-face interaction by the public at agencies such as the Office of Motor Vehicles. In addition, each agency is granted the authority to determine if part of its workforce can and should work remotely. I am also directing cabinet secretaries to find ways to reduce the need for in-person meetings with the public and with various stakeholders. We are also asking all state agency heads to identify and maximize opportunities for their employees to use telework while maintaining their normal functions. Thirdly, we are adjusting our election schedule. As recommended by, and because I agree with the Secretary of State, Kyle Ordwin, later today I will assign an executive order to move the April and May elections to the June-July timeframe. This will obviously include the presidential primary. The reasons include taking into account the older age of the majority of precinct volunteers and workers and the need to reduce public contact, and also to allow maximum participation by all voters regardless of their age and their health conditions. Also, the Louisiana Public Service Commission has issued an executive order prohibiting all public utility companies from disconnecting customers for non-payment of utility bills statewide beginning today until further notice. The time for serious action is now, as our presumed positive cases number continue to rise. We must be vigilant to protect all Louisianans, especially as we see cases spread to different parishes. We must come together as Louisianans and do what we do best, and that is be good neighbors to one another, be resilient. We are a state that's been tested and tried many times, and this test, to be sure, is a little different than those that we've faced in the past. But when we unite to help each other, our strength is far greater than we realize. We must be responsible citizens and good neighbors. It's obvious that we're not alone in taking such serious actions. At least 5 other states have made similar announcements today and yesterday. Much of the sports world took necessary steps to prevent large gathering and protect fans and athletes. Even Disney World, for example, will close its doors for a period of time. Our colleges are arranging to have online instruction. All of us are considering how to arrange our lives to avoid unnecessary interactions. And I want to take another opportunity to stress the way in which every single Louisianan, everybody in Louisiana right now, these are the things that you can do to help us to make sure that we minimize the spread and the adverse consequences of the coronavirus. Wash your hands frequently, and do so for at least 20 seconds with soap and water. And by the way, there's a lot of focus on hand sanitizer. That is not the best method to clean your hands anyway. The best method is soap and water, which remains readily available. So please use it and do that frequently. Cover your cough and sneeze into your arm if necessary. Avoid touching your face as much as possible. Routinely clean and disinfect frequently touched surfaces. Avoid close contact with others and stay home if you are sick. We started a public service announcement campaign with LSU head football coach Ed Orgeron and the U.S. Surgeon General Dr. Jerome Adams. They can be seen on television and heard on radio, and they're also on social media. We ask that you take heed to and share these messages as much as possible. It is my fervent belief that the sooner we minimize the spread of adverse health consequences from coronavirus, that the sooner that we're going to return to the Louisiana way of life and get back to normal. But there is some period of time where we're going to have a new normal. And we expect that these cases will continue to increase for some period of time. And so we want to make sure that the public also has that expectation. But that's also why we're calling upon them to really make sure that they are doing those things that we've asked them to do as a precaution to minimize the spread. So I'm going to be followed now by the mayor, and I want to thank her again for the opportunity to visit you and your team and for the work that you and all of your team is doing. Thank you very much.
Thank you, Governor. And it's good to have you here, good to work with you and your team, and I appreciate your commitment to Orleans Parish and the state of Louisiana as we deal with COVID-19. As expected, the number of additional cases have increased, not only overnight, but even as we were having our recent briefing, that number increased. And we do anticipate, as it was reported, more cases to come. We are seeing significant community spread. To limit and slow down this spread of the virus, our best tools are that to mitigate, and we are moving forward with our mitigation efforts. That means closing of the schools. It also means canceling public events. As you've heard from our governor, all schools statewide are being closed for 30 days. Staying in communication and collaboration with the Orleans Parish School Board, NOLA Public Schools, our independent operators, as well as the Archdiocese of the City of New Orleans. They're doing everything possible to create distant learning environments. OPSB and NOLA Public Schools have been working with our schools for the past weeks to prepare for this. Each school will be communicating independently and directly with families on the steps and resources that will be provided to support an ongoing student learning environment. So, again, the schools will be communicating directly with families, parents, as it relates to the schools where their children attend. New Orleans Public Schools is also providing support across schools and will be identifying additional citywide and system-wide needs. NOLA Public Schools, in collaboration with charter school leaders, with the Mayor's Office of Youth and Families and other agencies, we're coordinating a prolonged effort to ensure child nutrition services during this time, making sure that nutrition meals are available to our families and to our children throughout the next 30 days and beyond should we need to. A request was made to the USDA and was granted as it relates to nutrition for our students, for our families. This also speaks to children not only in school but also across the board citywide, all of our children. The district will share resources with families for how they may access food and nutrition services, again, during this time and also starting with next week with the school closure. They're asking for, after that first week, the district anticipates a citywide child nutrition program that will be available for all of our families throughout the city of New Orleans. To support both functions, the Orleans Parish School Board, and thank you so much, OPSB, for doing this, passed a resolution granting NOLA Public Schools the authority to access $5 million for emergency spending needs. We appreciate that very much. As you know, the state has issued guidance limiting public gatherings to 250 people. The governor went through this very thoroughly. Here in Orleans Parish, we want people to use, of course, common sense and good judgment as it relates to this. We're seeing even with some businesses are practicing their own or instituting their own limitations of people who are frequenting their businesses, maybe 50 at a time, some 10 at a time. But this will be determined by the private industry and the businesses themselves. Enforcement will be complaint-based, and we'll respond as needed. The New Orleans Public Police Department is urging citizens not to gather in large groups until further notice to help slow down the spread of COVID-19. Again, this is coming from our New Orleans Police Department, and again, enforcement will be complaint-based, and we will respond. Please do not block public streets or intersections. It is a public safety risk without proper police presence. This also, again, speaks to the cancellation of public events, those that are permitted through the city of New Orleans. We're not going to be, out counting heads. We trust that our people will follow the rules and just be good citizens. Public safety and public health remain our top priority as we move through this, and continues to. In addition, we will be restructuring the access to City Hall and city facilities. More of this will come. This will be a minimized and staggered approach as it relates to accessing City Hall. We will not allow more than 50 people, for example, to access City Hall. These practices will begin on Monday. Again, we will provide you with more information today as the processes are being finalized. City Hall is not closing. Your city government is functioning, and we are here to make sure that government runs for our residents, for our visitors, for our businesses. It's very important. City Hall is not closing. But again, we're making efforts to limit contact and reduce large groups. This also speaks for our employees, in which we will be communicating directly to employees of city government. City employees that are impacted by this outbreak will be placed on civil leave. Again, making sure that our people are consistently being paid. Also, this is paid leave. Okay, civil leave is paid leave. And we're calling on and encouraging private employers to do the same. What I do know, and from the Hospitality and Tourism Committee call this morning, many of our hospitality industries, in terms of hotels, are implementing their own policies, PTO, paid time off, for an extension of 14 days. This is not every hotel that I can report at this time, but you should know conversations are being had, and we're making progress with that. My next call with this Hospitality and Tourism Committee will be at 4 p.m. This afternoon. Let's see, all meetings, and this is from our New Orleans City Council, we've been working hand in hand, but all meetings of the council, committees, and regular meeting will be suspended at least until the end of March. The council is closing the chamber for use by boards and commissions and is urging them to take similar actions. We've been communicating with our boards and commissions across the board. They have been notified. I do anticipate, and the governor will move forward, asking a resolution of the legislature to suspend public meetings laws. This is important for the city of New Orleans as it relates to our ability to continue to do business. During the council or the chamber closure, the council offices will remain open to serve their constituents, and preferably, by phone. We're doing a lot of conference calls these days. We're not breaking any public meeting laws at this time. We don't plan to break any laws, but you do know we are having effective conversations with multiple stakeholders throughout the city of New Orleans. I've organized over 13 committees of our stakeholders. These committees range from neighborhood leaders, faith-based communities, hospitality and tourism, as I mentioned, the business community, primary schools, which includes pre-K through 12, committee for colleges and universities, housing and independent living facilities, nonprofit community, transportation, utilities, vulnerable populations. It really goes on and on, but the city is organizing ourselves, therefore, the way that we communicate with all of our stakeholders city-wide. I had as I reported on yesterday, a neighborhood leaders conference call where over 1,600 residents participated on that call. I do anticipate scheduling another call with neighborhood leaders, and that information will be forthcoming. We are working very closely with our fellow elected leaders, both on the local, state, and federal levels. Yesterday, as I reported, I formally reached out to our congressional delegation for support at the federal level, and they've been extremely responsive. And as it was reported, our president declared a national emergency, and that really does help. It unlocks resources at the state level, and of course, that benefits us locally. As with the declarations the governor and I both issued yesterday, again, this will unlock additional resources, and we will update you as we plan and also facilitate any other public assistance for individual assistance. We'll be making this information readily available. I have Also, I wanted to thank our community partners, particularly the Greater New Orleans Foundation, who has activated our disaster fund, and they are also a co-chair representing us on the nonprofit committee. United Way also stepped up, making available over $100,000 that has been contributed to this disaster fund. Let me tell you what we are not doing. We are not limiting the sale of alcohol. That was something that seemed to have been misconstrued based on the declaration that was made on yesterday. What it says that should it be necessary, that I have the authority to do just that. But as of now, we are not limiting the sale of alcohol. We are not shutting down private businesses or forcing them to close. While these closures and cancellations are extremely disruptive, the work of the city, it must go on. So the public health, again, is public safety, and that is our top priority. What I will ask right now is for Dr. Jennifer Avegno, who serves as our Director of Health, to come and give us the most latest updates and briefings at this time. Dr. Avegno?
Thank you, Mayor, Governor. As the governor said, we have 36 presumed positive cases in Louisiana. There are 26 presumptive positive cases of COVID-19 right now in New Orleans, and we expect that number to rise. This situation clearly indicated to all the leaders here that significant community spread of the virus and the time to act is now. We have to do, as you've heard, we have to do everything we can to protect those who are most vulnerable, the elderly and the chronically ill. What we know of this epidemic is very clear, that they are affected far more severely and at much higher risk of death than others. The best way to do this is to slow the spread of the virus, as we've said, by significantly reducing interaction between individuals and groups, and that is why the decision was made to close schools, limit access to public facilities, and limit social gatherings. These are all ways that the virus is spread from person to person. What we need to do now as I've said before, is to flatten the curve of this epidemic. I want to reiterate that we are not taking these measures largely because of the risk to the average person. Relatively healthy people who contract COVID-19 tend to have mild symptoms like the flu or a cold and do not require hospitalization. However, elderly individuals, those with chronic medical issues are at far greater risk for severe illness. I can't emphasize this enough. These are the people we do not want to contract the virus. And all 400,000 New Orleanians and all Louisianians have a role to play in protecting these individuals. On our public safety side, as the mayor said, we are all hands on deck. Our public safety agencies are equipped with personal protective equipment and will be utilizing it when responding to calls with flu-like symptoms. 911 call takers are trained to ask specific questions to determine if a call for assistance might be from a patient at risk of COVID-19. The New Orleans Police Department is asking for your cooperation in following the governor's ban in gatherings of more than 250 people. It is very important that we all reserve emergency services for those who truly need them. If you have a fever, cough, shortness of breath, or other symptoms, please call your doctor. We urge the public only use 911 in hospitals for life-threatening emergencies. We have been through a lot as New Orleanians, both recently and both in our history, and the sacrifices and changes to daily life we're asking you to make during this time are no different than in previous times. Be in touch regularly with your elderly and chronically ill loved ones. Call your neighbor, your family member to see if they need help. We can still be community even if it's not in person. There are also real ways that you can help the people most effective. The best way to support in a crisis is to offer financial donations. As Mayor Cantrell said, yesterday the Greater New Orleans Foundation activated the Disaster Response and Restoration Fund, which will help nonprofits taking care of our elderly, homeless, and low-wage workers. Today, the United Way also announced a $100,000 contribution to that fund. The New Orleans Council on Aging is taking financial donations to support seniors through its Meals on Wheels program and other services, which we expect to increase. Second Harvest Food Bank is also accepting donations, monetary donations, and those of fresh produce, non-perishable food items, cleaning supplies, soap, and hand sanitizer. Please find an agency that is doing work such as these and find a way to use your energy, your time, and your talents to assist them. As we've all heard, there's a lot of rumors and misinformation out there. And I want to continue to reiterate, this is not a time to panic. It is a time for your continued attention. Information is one of the most important ways we can slow the spread of this virus. So please continue to make sure you're getting your information from reliable sources, including the CDC, Louisiana Department of Health, and here in New Orleans, NOLA Ready. We're going to say it again. Text COVID NOLA, all one word, to 888-777. Follow us on social media at NOLA Ready. Go to readynola.gov for updates. Please understand that these decisions being made today on every level are not made lightly. Our cultural traditions, our gatherings, our churches are the backbone of our community. But to be community, we have to protect those most at risk. We will need to be creative, and that is something that Louisianians and New Orleanians are excellent at doing. So thank you all for your attention.
Thank you so much. Thank you so much. And one thing that we will continue to echo, that we are unified in our approach and our levels of communication, and we are extremely hopeful that we're going to get through this. We just remain calm, be patient, work together, and show the spirit of empathy that we know that we can, and that's by meeting our people where they are. So with that, Governor, you want to go ahead and take some questions?
This is for Mayor Cantrell.
Yes.
If there is a suspension of the public records law, can you guarantee that there'll still be advance notice of those meetings and live video feeds of those those meetings?
Absolutely. Any way that we can make the public be involved and engaged, and whether that is viewing meetings remotely, we will absolutely put those measures in place. We're working through that right now through our IT department and determining what all of our options are. And so absolutely, this is only a method and a measure so that business can continue within city government. And there are projects that are in queue, development projects that we want to keep going. And I want to do the best that we can to ensure that work continues to happen.
With schools out for a month, that's, we know it's going to put a strain on working families.
Sure.
Working families are doing essential duties in our city. What are the city and the state doing to address childcare needs?
Well, they're really working through that now. We know, and as I mentioned, yesterday and the day before, as we've always not, really have been not wanting to get to the point where we've had to close schools, but we are here. And we knew that in doing so, that it creates an even greater disruption, and this is one of them. The impacts of child care, the impacts of even our workers being able to even work, and not just in city government, but in businesses throughout the city of New Orleans, our hospitality, our tourism industry, and the like. So we're all really putting our heads together in this regard to be able to meet the needs of our employees, but right now there is no coordinated effort, that I can report to you on right now, but just know that those conversations are being had, and we are laser focused on the needs of all of our people in the city, and child care is one of them. I think to the governor's point, and I know he'll want to add, but even him mentioning that, a lot of our elderly in some cases have been the backbones to, of our families that support system, and we're not wanting that to happen as it relates to the impact of COVID-19 on our elderly. Governor?
No, I think the mayor got it exactly right. What was very clear to me in consultation with the Department of Education today, as well as school districts around the state, was that we got to a point where obviously we don't want to be. There's not a single announcement that I or the mayor announced today that were things that we wanted to do. These are things that we felt compelled to do by the circumstances as we face them, because we are at an inflection point. We are trying to identify things that we can do to help with respect to the child care situation, and I think you're going to see some announcements perhaps around unemployment insurance benefits on an emergency basis in expanded capacity, and those sorts of things. But what we didn't want to happen was for school districts to start making the decision to close without adequate notice. So what we did is we made sure that people have the weekend to make the best possible arrangement that they can make for their school children. And look, this was probably the single of all the decisions that I made today that I announced. This was the one that was toughest to make. But I'm convinced, and I think we were the 7th state to affect school closures, and I think you're going to see a lot more of these coming, based upon the guidance we're getting from CDC and the things that we've been told to take into account for our decision making, and the fact that we're at an inflection point right now, that it was essential to do it. And we know that we have strong, resilient people. We are telling them what they need to do to best protect themselves and their families from coronavirus, and we're going to help them everywhere that we can, but we need to give them the opportunity to have time to make the best possible decision for themselves, their families, and certainly their children.
Absolutely. And what I will also add to that, based on the governor's proclamation, is waiving the number of days as it relates to being in school. There's a threshold there. So with eliminating or preventing or bringing in the school closures for the next 30 days, that will not have, an impact on that required number. And he speaks to that in that proclamation. But I cannot overstate the leadership of our schools collectively. They have really been laser focused on not just child care, but on child nutrition. And so we're going to work through it. We're making some progress there as we reported on with nutrition, but they're leaning in. followed by WBHD.
Governor.
Yes, sir.
Are any provisions being made for prisons and jails? And how does the gathering or gatherings affect the meals and recreation, other gatherings within criminal justice facilities?
Okay, so we already took action with respect, and I think it was in my prepared remarks, and if it wasn't, I apologize, I just read right past them. But with respect to visiting nursing homes and hospitals, prisons and jails, we've already put a 30-day restriction on that. And it has to be essential visitation, for example, with respect to nursing homes. And this is something Seema Verna, who runs CMS, actually announced at the press conference the president had today. We actually took these actions yesterday. We are not allowing non-essential visitation because we have individuals, think about a prison, all those individuals living in close proximity to one another, and our prisons have relatively limited medical capacity as well. And so for the sake of the loved one that you have in prison, in jail, in hospital, in the nursing home, that is why we are trying to protect them. We're not trying to limit your visitation in any way to punish anybody or anything like that. This is just an essential thing that we need to do because many of those people are the most vulnerable with because of age and underlying health conditions and so forth. Obviously, the inside the prisons, they're going to continue to feed as they normally do. They do have the options to do that in shifts so that they don't. But you know, those are things that our leaders are taking into account right now all across the state of Louisiana. So we had already made those decisions yesterday.
This may be a better question for Dr. Vegno. Can you talk about testing? Is it being done sufficiently? Is there some things that are being done to look at the process?
You want to? Yeah,
Or
I'm
a
on
question
up.
for Dr. Alex.
I'm going to introduce Dr. Alex Beer, the head of the State Office of Public Health, and we can tag team that.
Yeah, no, I think we need to continue to ramp up our testing efforts. You've been seeing that consistently since we've had the ability to test, certainly within the state, and even before then when the CDC was testing. This morning we made an announcement really to clarify guidance for providers across the state that we believe that any individual in Louisiana who has symptoms consistent with COVID, having that fever and then a cough or shortness of breath, and who's flu negative should get a COVID-19 test. The flu test is important because, again, as you've heard us also say consistently, the flu, we're in the middle of flu season, and the flu is actually treatable. We have medications for that. The flu killed 1,500 to 1,600 people last year, so we don't want to forget that. We don't want to lose that from what we're doing right now. That being said, we know the vital heart that New Orleans plays for the state, and we know that people from around the state come and visit this city. And since we do believe we have widespread community spread, we think it's vital as well that we're testing across the state to get out ahead of this. We do not want to be on the back foot.
If I could add to that, I will tell you that we've been in constant communication with our local clinics, healthcare facilities. They are all working to get as much availability of commercial tests as exist locally. There is not a satisfactory supply of commercial tests anywhere in the country, and I think you heard the president and others talk about how that might increase in the next week, and we would all welcome that. But I know that all of our hospitals and many of our clinics are really trying to be creative in how they get access to commercially available testing.
And Alex, do you want to speak, though, to the improvements there, the rapid response?
Sure, and we can speak specifically to changes within the city of New Orleans. I mean, obviously, this is where the majority of cases are, as you heard Dr. Vegno announce earlier. And to meet the demands that the city's hospitals and healthcare providers have seen, we've started 3 to 4 times daily courier pickups of samples coming from New Orleans directly to our state lab, where people who are hospitalized are being tested. We're also running around the clock the testing machines at our state lab for those, again, most critically ill folks and people who may be the most vulnerable, the people we need to get a quick answer for. But to be clear and to underline Dr. Vegno's point, when we're talking about testing at scale across the state, that is not something that can be done purely at the state lab. We're going to need partnership and leadership, as you heard, from the commercial private labs as well.
Well, and you've been tapping into that.
Yeah, that's correct. We've seen people using private labs already, and we understand there's groups like Oshner really trying to locate additional new labs that are coming online.
Yeah. Absolutely.
Fox 8 followed by WWL and WGNO. First of all, are you all looking at any sort of lockdown procedures or shelter-in-place containment zones at any at this point in planning ahead?
We can talk about our surge.
Yeah, I'm going to let the mayor address that because I know she's got some ideas. I don't know that anything that she's going to say is going to fit the description you just gave. The things we're contemplating doing are the things that I've announced. And those are things that we're doing, actions we're taking based upon CDC guidance as to what we understand the facts to be right now, based upon the positive test results, where those test results are spread around the state and concentrated in the city here with at least one cluster. These are the essential things that we think we need to do to maximize public safety and reduce the spread and the adverse consequences of this coronavirus. So when it, I'm not contemplating at the present any lockdowns, and I can't remember everything that you just said, other than those things that I set forth in the amended proclamation that I issued today to amend the the declaration that I issued earlier this week.
Right, and one of the points I think that can be made as of no lockdowns, but as it relates to surge capacity at hospitals, we are being proactive in that regard, looking at alternative locations for such a surge. One of the locations that I've placed on the table this afternoon is the old VA hospital, for example. We will be doing walkthroughs with the state team to ensure if it's, we know, to make sure that it's adequately prepared for such a surge. We're also exploring the options if we have to erect a tent, for example. But we're being absolutely forward-thinking, and I think that's the most important thing that you should know. Okay?
Two, one for the governor, one for the mayor. Governor, in regards to, since so many cases are concentrated here in the New Orleans area, do you find yourself directing a greater amount of state resources this way? For the mayor, are you aware of any suspected cases here at City Hall?
Well, I mean, yes, that answer sort of speaks for itself because I'm here in New Orleans at this press conference. This is the center of gravity for the response effort now that we're in the mitigation phase of this response to coronavirus. But I am concerned about the whole state. And if you look at what has played out, not just in other parts of the United States, but around the world, these positive cases start popping up and you have community spread, and it is impossible to know with any precision where that's going to happen. That's why I said we were at an inflection point. The things that we're doing statewide because we have to do everything we can to get in front of this. So obviously we're devoting more resources here because the lion's share of the testing is coming out of New Orleans area, the lion's share of the surveillance testing, not just the persons under investigation, PUIs, I'm sorry. Not just the PUIs, but the surveillance testing and so forth. And this is where we're doing our planning for surge capacity, for example, to make sure that if we have individuals who don't have a home to go to, but they don't need to be hospitalized and they are positive, where we're going to put those individuals. And these are just some of the things that we're coordinating with the city of New Orleans, but they're things that we potentially will have to replicate everywhere around the state of Louisiana.
And as for the city of New Orleans, we've been leaders in this regard, and based on the impacts within our city, caused me not to wait, to have to take action sooner rather than later, and we'll continue to be on that side and say, damn if you do, damn if you don't. You can be rest assured I'm going to be on that damn if I do, because we're going to do, and we've demonstrated that. As it relates to city employees, now you said City Hall, but I'm looking at all my people, right? And we have 7 of our first responders, as I reported on yesterday, that we have in quarantine. I know that one also went to be tested on yesterday because the symptoms really did require that. I have not been given the results of that particular test, but our people do remain on quarantine, meaning those 7. Members of our employees who have reported that they are sick, not necessarily symptoms of COVID-19, they have been asked to stay home, and they're doing just that. We will be implementing a work from home policy when we'll be communicating that more effectively with our employees when that time comes. But we're prepared to respond to the needs of our people, and at the end of the day, really do protect our first responders who are our first line of defense in this.
Counselor, I know it is flu season. There's a lot of people who have already had the flu or had flu-like symptoms. Do those people who had those flu-like symptoms but didn't go and get checked, do they need to be concerned about their health at this point?
So I would say if you are asymptomatic right now, then you can take the usual precautions as you would for your health. You can and limit your contact with those who might be elderly or sick, but go about your daily business. At this time, there's no recommendation for testing for COVID-19 of anyone who's asymptomatic.
What resources are being dedicated at the state and local level to figuring this out, and how are they being allocated?
Okay, cover.
That's a pretty broad question, figuring this out. But no, but that is where we spend our time, and this is what we've been focused on, really, not just yesterday or today, but we convened our I don't know when it was, weeks ago. We got together with the Department of Health and different state agencies, set up a task force. We've had multiple UCG meetings now. We're in constant communication with local partners to try to figure out what their needs are and try to anticipate what their needs are going to be. And that's where we spend our time planning and allocating resources. I was very heartened today by the press conference that we just heard that it appears that if those things come to fruition, and I do want to manage expectations, not about whether we're going to have more robust testing available. The press conference was in Washington today. Those tests are not going to be available tonight. Okay? And so I need everybody to understand that it takes time to put these things into place, and in the meantime, we're going to continue doing things as best we can with the resources we have available, which is why, for example, Dr. Bu said that we are using our relatively low throughput state lab testing for those cases that are most critical that we know if they had COVID-19, because these are seriously ill patients who are actually in the hospital. If someone potentially has COVID-19 because they are symptomatic and they are flu negative, but they are going to be treated at home, you don't need to know 6 hours from now if they have it as much as you need to know 6 hours from now that those individuals who are in the hospital have it. So those are the types of things that we're doing, and it is time consuming. It is difficult, but with the lines of communication that we have, the coordination we have, up to the CDC and other federal partners at Health and Human Services, for example, and I'm hopeful the VA and many other federal partners, but across the state and then down to local officials such as the mayor and her team. That's where we're spending our time, and we're doing the very best that we can. I will tell you, it is almost impossible to think that you can anticipate today all the ways that this coronavirus is going to manifest itself into a challenge. But we're trying very hard to anticipate the biggest challenges and the ones that require the allocation of resources now so that we can be prepared. We don't want to be coming in behind this thing. We want to get out as far in front of it as we can. And I know that that's a long and winding answer to what I thought was a relatively imprecise question, but it's the best way that I can try to articulate what it is that we're doing these days.
Yeah, and what I will say to what I do remember of your question is that, my administration, along with that of the New Orleans City Council, we were very protective of our fund balance. And we went to bat for that. My administration did, and the City Council followed suit, meaning that we protected our fund balance for these types of events. But the bottom line is, make no mistake about it, this is yet another threat to our budget and our bottom line to run city government. You know, we've just coming out of the cyber attack. We've had lost revenues as it relates to Hard Rock. There are many things that we've had to deal with and address, which speaks to why I reached out at that federal level prior to the president's announcement this afternoon to ensure that, one, federal dollars would be unlocked to help us at the local level. And we're seeing that that has now happened, meaning the declaration by the president, but it will take some time for those processes and those dollars and resources to flow, kind of like what the governor mentioned. But we know that we will have a negative impact to our 2020 budget and even the projections that are tied to that budget. Make no mistake about it. But we also know that our business owners and leaders throughout the city of New Orleans will be taking a great hit as well. So we're going to be leaning heavily on these federal resources, working collaboratively with our governor, the full state of Louisiana, to ensure that we're able to meet our people where they are consistently.
Two more questions. Delenn, followed by last question, Fox 8.
So you all have asked people who are symptomatic to stay home from work, to go get tested. As you know, not everyone has insurance in the state, and maybe doesn't have the savings to go, spend that at a hospital, or even make rent if they have to take time off of work. So, two questions here. First, what would you say to someone who's questioning whether they can afford to follow the directions and the requests that you're giving them? And number two, has this caused you to reflect on the adequacy of the social safety net in Louisiana and New Orleans?
So to speak to the testing, it's been really gratifying to see that the leaders in trying to obtain the commercially available tests have been some of our federally qualified health centers. And these are health centers that agree to take everyone regardless of ability to pay. And so what they have communicated to me is that LabCorp, who is one of the major organizations providing commercial tests, is waiving the test fee through, I believe it's until April, or when they are expecting that CMS will provide guidance waiving the fee for everyone. That's something that's been talked about at a federal level. So I would encourage everyone, regardless of insurance status, because certainly we are in a lot better place than other states because we have Medicaid expansion, and that provides access for many, many more people. But even those who do not have that, we encourage them to call their healthcare provider, call one of the clinics, or find a clinic and see if testing is appropriate for them, and then not to let price be a barrier.
Right, and as it relates to Governor?
Yeah, well, I did want to follow up because some of the things that came out in the president's press conference today about expanded testing and this website that Google's going to put up, where as soon as that is ready, people are going to be able to go and type in their symptoms and their questions, and they're going to be given guidance about whether they need a test, and if so, how they can have that test administered. We're some days, or I don't know what time period we are before that kicks in, but obviously that will be very helpful. In the meantime, I would point out that we have 460,000 poor people with health insurance today who didn't have it. And they've had access to primary care and preventative care, and so they actually have a physician with whom they have a relationship. And so we still have people who don't have that relationship with a provider, with a doctor, primary care doctor, and we still have some people who are uninsured, but we have the lowest percentage of people uninsured in our state's history. So that is very helpful as we try to get through this particular process. But we are doing everything we can to make sure that inability to pay is not a barrier to a test for someone who needs to have a test, as has been stated here today by Dr. Bu and Dr. Vagnot.
And as it relates to, you mentioned just social needs and that sort of thing, that's one of the reasons why within our administration and city we have organized committees as it relates to stakeholders, because that's the most important thing, to strengthen the lines of communication throughout those various sectors so that we can collectively understand the resources that we have available and begin to exchange and share those resources in a more collaborative manner. It speaks to the Committee on Nonprofits, for example. So we're working with GNOF, activating that disaster fund, working with United Way. You begin to clearly have a better sense of your nonprofit community and therefore the resources that could be extended to your population of people, meaning your residents. In addition to that, it speaks to our ability in terms of housing, having the housing in terms of committee. Because one, we are collectively working with, our landlords as well. HANO, the Housing Authority of New Orleans, for example. We have our residents who are, in section. We're really thinking through the vulnerabilities that our population, our residents will have to deal with, and coming up with strategies, again, to meet them where they are. But through that organizing, that's going to lend itself very well for us to do the outreach that's going to be necessary.
And is there any thought on the local or the state level of trying to do something to suspend for a time evictions in the state to keep the people in their homes?
Well, through my housing committee that has been coordinated, that is something that is on our plate that we are working on right now. I don't have the specific details for you now, but just know that those are conversations that are happening today, started happening on yesterday, and we'll continue to move through them. But working with all of our housing partners, it also speaks to our homeless population as well. We've worked with, for example, one of our partners, Hotel Hope, that has turned over Hotel Hope to the city to therefore in terms of placement of our people. So we're working again in coordination with our stakeholders across the city, but it does start with one being organized. And so we've organized over 13 committees for this purpose on many different layers and levels.
I was just curious when we're talking about the expansion of benefits specifically for the state, what about SNAP for those who might need it?
Yeah, so we are looking at, and by the way, we're trying to determine exactly what the declaration of emergency was today and how that relates to this particular issue around emergency SNAP, or we would typically call it DSNAP, disaster SNAP, and I think that would apply here. And so we're going to take full advantage of everything that's made available to us by virtue of that declaration today and the specific measures that they talked about. We're looking now back in Baton Rouge to investigate every opportunity we have, and certainly we're going to take advantage of those that we can. And if we think that maybe it's unclear as to whether there's been assistance provided that we need, we're going to be requesting it anyway.
Absolutely.
I promise they will be telling me no on some things, I can assure you, based on what I can envision right now transpiring over the coming days and weeks.
Last question, the advocate.
Real quick one, wondering if you can update on how many tests have been conducted and whether you can talk about how many people at Lambeth House have tested positive at this point, given the updates.
Well, I'll start, and then Dr. B will come up. We have nine positive, presumed positive cases at Lambeth House. That is the one cluster that we have, that we know of in Louisiana. It's here in Orleans Parish. And as the Surgeon General mentioned yesterday morning when he was in Baton Rouge, the testing that we have been able to do is comprised of both surveillance testing and for persons under investigation. And the persons under investigation are being tested at the public lab in Baton Rouge, and in accordance with the CDC's criteria that has been set forth. And the commercial testing that is just now becoming available is going to be used by other individuals who are not currently hospitalized and won't need to be hospitalized if they're positive, because it may take up to 4 days to get that result back, whereas with our limited testing in Baton Rouge, we're able to get that result in about 8 hours, 10 hours, something like that. And so it's essential that we know that those individuals who are already in the hospital, who are seriously ill from this infection, whether they are positive or not. As for the total amount of tests that we've run and any clarification of what I've just said, I'll ask Dr. Bu to come up.
With the experience and resources for cases throughout Louisiana, Walters Papillon Thomas Collins LLC is proud to support LPB, specializing in personal injury and wrongful death, with information at lawbr.net.